Hello parents, myself Dr. Anupriya. In this course, we'll discuss about the summer care for babies. As summer's approaching, it's really important for you to know how to take care of your baby's skin. Now the objectives. Why is baby's skin so sensitive? What all issues can your baby have during summers? How do you manage them? Diet during summers and clothing in summers. Now, why do we need to care for baby's skin more? As baby's skin is thinner and more delicate than adults, they are more prone to dryness, irritation and sunburns. Also, the baby's skin have fewer sweat glands, which can make it harder for the baby to regulate their body temperature, which means they can overheat very quickly during summers. Now, what are the skin issues in summers? Firstly, sunburns. Babies have less amount of melanin, which protects your skin against the UV rays, so they are more prone to sunburns. Heat rash. Blocked sweat glands can lead to raised itchy bumps, which are called prickly heat or heat rash. Dryness. Hot weather or using AC can cause dryness of baby's skin. Fungal infection. So infection caused by fungi such as candida or dermatophytes are more common during summers due to warm and moist environment like sweaty skin folds, which promotes fungal growth. Insect bites. These are reactions to the bites by mosquitoes, flies, ants, as they are more active during summers. Atopic dermatitis. It is a chronic inflammatory condition which leads to dryness, itchiness and inflamed skin. So heat and sweating can trigger eczema flare-ups, hence it is more common during summers. Now, how do you manage the skin issues? Dress your baby in loose-fitting clothes made up of natural fibers like cotton. Avoid synthetic material as it can trap heat. Appropriate layering. Avoid overdressing. Dress your baby in just enough clothing to keep them calm and comfortable. Cool environment. Maintain a cool environment indoors by using ACs or fans. Avoid direct airflow towards the baby. Reduce humidity. If possible, you can use a dehumidifier, as increased humidity can make the baby more prone to such conditions and worsen it. Hydration is the key. Ensure that your baby is well hydrated. So for babies less than 6 months of age, you can breastfeed or formula feed. Water is not necessary. If you feel that your baby is thirsty, you can breastfeed or give them formula often. For babies who are above 6 months, in addition to breastfeeding or formula feed, you can give water in between. Monitor the urine output. So keep a count of wet diapers so that you ensure hydration of your baby. Decreased urine count is a sign of dehydration. Gentle bathing practices. Lukewarm baths. Give your baby frequent short baths with lukewarm water. Avoid hot water as it can dry out the skin. Mild cleansers. Use mild, fragrance-free baby soap or cleanser. Avoid harsh soap or bubble baths. Pat dry. Gently pat dry your baby's skin with a soft towel. Avoid rubbing as it can irritate the skin. Now, when it comes to the frequency, do not bathe your baby frequently as it can dry out the skin. Few times a week is good enough with frequent changing of diapers. Take care of the diaper area. Sun protection. Avoid direct sun exposure, especially during the peak hours, that's between 10 a.m. to 4 p.m. Keep your baby in shade as much as possible. Use umbrellas, strollers with canopies or natural shade. Protective clothing. Dress your baby in light, long sleeve clothing with wide brimmed hats. Sunscreen. If your baby is beyond 6 months of age, you can use a sunscreen. So apply a broad spectrum, water resistant with an SPF of at least 30 or above. You can choose a mineral based one with zinc oxide or titanium oxide. Next is diaper care. So frequent change. Change the baby's diaper frequently every 3 to 4 hours. Do not let the skin remain in long contact with stool or urine. Change it as soon as it's soiled. Air dry. Allow your baby's skin to air dry between the diaper change. Barrier creams. You can use zinc oxide based petroleum jelly during the diaper change so that it forms a layer between the skin and the stool or urine. Avoid irritants. Use fragrance-free products. So use fragrance-free, dye-free laundry detergents, moisturizers, lotions. Clothing. Make sure you dress your baby in light, breathable, natural fabrics like cotton to avoid friction and irritation. That's why you can choose gentle fabrics which is natural like cotton. Monitor for specific conditions. Heat rash. Be vigilant for tiny red bumps which are heat rash. Once it develops, follow cooling and drying measures as mentioned previously. Eczema. If your baby has eczema, Follow your doctor's recommendation to manage flare-ups, which includes frequent moisturizing and topical creams. Infection. Watch for signs of skin infections like pus, redness, warmth, pain. Seek medical attention if you see any of these. Thank you.